Hi, I'm Dr. Chrissy Elrod. I'm a licensed therapist with a PhD and a breast cancer survivor with PTSD. Today, I'm talking about how medical trauma is really disenfranchised trauma. Because so many patients suffer in silence, medical trauma can be considered disenfranchised trauma. I use the word disenfranchised simply to mean unacknowledged. You might have also heard the term disenfranchised grief, which is another thing that isn't talked about enough or acknowledged. But in this context, I'm talking about medical trauma as disenfranchised trauma. There's really only one textbook out there written by Dr. Michelle Flom about the treatment of medical trauma. Despite integrated care, boutique care, patient-centered care, medicine is still largely focused on the body. So medical trauma isn't really on the radar for providers or family members, and it's oftentimes not even for the patients themselves on the radar. They may not even know that they have it. I didn't know or have the words for what was going on until I developed PTSD from my life-saving procedures. This was all during breast cancer treatment and after I had a PhD. So I didn't have the words to talk about this, and I was desperately trying to find my way out. There's also still a really big stigma in asking for help for mental health treatment for medical trauma. So part of what I'm trying to do in my capstone project for my certificate in medical trauma counseling at Xavier University is to bring education and awareness about medical trauma so that people have the words to be able to describe what's going on for them and to be able to speak up for themselves to their providers or to help their family members speak up for them. I also want this to be a research opportunity and a resource for medical providers. I would love for doctors and treatment providers to be using this as a resource to educate themselves about medical trauma. Thanks for following along. Please like and subscribe and follow and comment along. Thank you so much. I appreciate you all.